All right, well, welcome everyone. My name is Dr. Michelle Henney, and I am the medical director and founder of Releve Sports Medicine in Winter Haven in Central Florida. I am moderating as a member of the Sports Economics Subcommittee chaired by Dr. Elliott Hugh within the Practice and Policy Committee of AMSSM. Our next talk as part of our Sports Medicine Economics series will be the Introduction to Billing and Coding with CMS Updates that will be presented by Dr. Michael Schwartzen and moderated by Dr. Marcia Newby Goodman. And this will occur later this spring. So I'm going to introduce our speaker for this evening. Dr. Matt Leisler serves as the Program Director of Sports Medicine at the University of Notre Dame. In this position, Dr. Leisler oversees the healthcare of varsity student athletes while also serving as a member of the University Health Services Management Team and providing improved insight to Notre Dame athletics with regards to campus-wide issues. Dr. Leisler joined the University of Notre Dame in 2014 as the head football team physician. Prior to joining Notre Dame, Dr. Leisler serves as the faculty member at the University of Colorado Hospital for 2 years. He graduated cum laude from Harvard University in 2003 with a bachelor's degree in biology before earning a medical degree from the University of Kansas School of Medicine in 2008. After his residency in 2011 with the University of Colorado Family Medicine Residency Program, Dr. Leisler completed a sports medicine fellowship with the University of Colorado Hospital in 2012. He is board certified in both family medicine and sports medicine. A native of Derby, Kansas, Dr. Leisler was a varsity letter-winning running back on the football team at Harvard University. Dr. Leisler lives in the South Bend area with his wife, Tori, and their 3 children. He will be presenting this evening on the 2021 AMSSM Combined Membership Survey, new and recent graduate data. And if you have any questions, you can put those into the chat and we will review those at the conclusion of the presentation.
Great. Thanks, Michelle, and very glad to be here this evening. Thanks to everyone for joining and those that join later on YouTube. So let me go ahead and share my screen here. Great. Does that look okay for everyone? All right. So essentially just kind of an introduction to the information that I'm sharing this evening. So AMSSM sends out a survey every February or March to all members, both learners and attendings. And it asks a large range of questions, everything from your location to how many patients you see in a half day to your total annual compensation, the type of practice that you have. And so it's a lot of information. Each of the past several years, so 7 or 8 years, I've kind of combed this data and tried to pull out information that would be useful for current fellows, current residents, or recent graduates. The primary reason for that was trying to help individuals with contract negotiations as they're starting their first job or maybe reworking their first contract. Typically, in the past, there are some sources of information out there. The MGMA, or Medical Group Management Association, does put out some information, and it's great information, but it does cost money. And so one of the goals was provide something for AMSSM members, but maybe more importantly, provide data that's specific to recent graduates. So instead of comparing my contract, if I'm just finishing fellowship, to all the AMS or all the sports medicine physicians out there that may have been in practice for decades, I'm comparing more apples to apples. And so the goal is to provide some information that that individuals can use to their benefit, to have a sense of the numbers as they go into contract negotiations. So this is now described as a combined survey. It used to be 2 separate surveys, and now there's one big survey that all AMSSM members receive. The overall response rate is about 30.5%. So not great numbers, but enough that we get a lot of data from this. One really important disclosure with this information. So this is all self-reported data. So I received my link. I'm going to put in all the information, and I'm going to, trust that others are honest about it. But certainly, we're assuming that, and so we're trusting others with their self-reported data. And there is some risk of bias by nature of a response bias. If certain individuals are more likely to complete the survey, then that may lead to different data. So just keep that in mind as we're looking at this. So from last year, so this is from 2021 in the spring, there were a total of 782 responses from those that are in practice, right? So we get more responses from residents and fellows. This data is not from that group. This is anyone that has completed fellowship and is in training, or is no longer in training and is into their first actual attending positions. So you can see that, we break it down by number of years in practice, and throughout this presentation, I'll reference, those in their first year. So those, clearly on their first contract, and then, a second group that I look at often is 0 to 5 years. So those that are very early in their career. And then we'll look at 6+ years. So those that are probably on, in some cases their second job, or they've been, in a job for and established for at least 5 years. You'll see that about 1/3 of the respondents are in their first 5 years, and about 2/3 are beyond 5 years. One of the questions that is asked is, what is your primary board certification? So I dig into that information a little bit. As we look at those that are in their first year, there were 69 individuals that answered this particular question. 62% were from family medicine. And then you can see, the groups from that. So 14.5% from PM&R and 13% from pediatrics. If you look at AMSSM as a whole, family medicine is 71% of the membership. PM&R is 10% of the membership, and pediatrics is 8% of the membership. So one thing you'll notice is, and this seems to be the trend, especially over the last 5 years, the number of sports medicine physicians that are answering the survey, and I think part of the society are PM&R members, and that's a trend that we're certainly seeing more. The pediatrics percentage in some cases has dropped, although my sense is that the number of pediatric sports medicine physicians is staying about the same, but the group as a whole is increasing, especially the PM&R contingent. If you look at those 0 to 5 years in practice, again, compared to 0 to 1 year, the family medicine group is slightly higher, 68%. PM&R group is 18%, and pediatrics, if you look at this group, is a little bit lower. And then, interestingly, if you compare that to the 68 and the 18 and 6% to the group 6+ years into practice, so more significant number that are in family medicine compared to the second largest group, and the 6+ years is pediatrics, and then PM&R is lower on the list there at 5%. So certainly a trend that we're starting to see within the membership with an increase in the PM&R background or primary board certification. So, one of the important questions that's asked is, what is your total annual compensation? The intention of this question is kind of all in. If your salary, if you have incentives, what is your annual compensation in total? And so this is looking at everyone 0 to 25 years plus in practice. And so 686 physicians answer this question, and the average is 274,000. You'll see on most of these slides, we talk about the average, which again is the mean, right? If you take all of these and divide them by the number of individuals that answered the question, that's the average. And for the most part, the average tends to run higher than the 50th percentile. The 50th percentile is if you were to line up all these salaries and take half above, half below, and the one in the middle is the one that's reported there at the 50th percentile, and then apply those same rules to the 25th or 75th percentile. And so, 50th percentile is often, I think, a very useful metric. And so all in for the entire group, 250,000 was at the 50th percentile. As you can see at the bottom, the range is huge. So in this group, the reported salary range was 110,000 to 750. And so that really reflects the heterogeneity of our group, which is really, I think, one of the cool parts of sports medicine physicians, is that really there are so many types of jobs out there, everything from orthopedic practices to the military to the college setting, which is where I'm at, hospital medicine. It really is very vast and wide ranging. And so I think as a result, the salaries are also very wide ranging. And so if we break this down into 0 to 1 year in practice, you may see that the average as well as the 50th percentile are lower, right? And that makes sense. So these are individuals that are just finishing their training and starting their first job. And so as expected, these numbers are lower. So 50th percentile, 230, average about the same, because as you can see, the range is smaller in this 0 to 1 year. And that makes sense. You know, coming out of residency or fellowship, you may not get some of those higher salaries, as you can imagine. But I think as you work into your 0 to 5 years, you start to see some individuals that are making pretty good money from an incentive standpoint. And so you see the range grows up to 650,000. And following suit, you know, the 50th percentile also increases, as does the average salary. About the 50th percentile is about $10,000 per year higher in this group than the 0 to 1 year group. And then if you compare this to the 6+ years, then you have about a $35,000 increase in the 50th percentile and a little over $40,000 increase in the average. And again, a wide range. And so you can see, you know, as expected, the salaries do increase. So some factors that can play into that certainly vary over time. You know, certainly the background of the specialty can play into that, especially as we, you know, maybe have some changes in the distribution of, you know, family practice residents versus or background versus pediatric background. And so, you know, we tried to look at that as well, and we'll get to those slides in a little bit. This is just, I think, a compilation slide of the last few that we've looked at. And so the blue would be looking at 0 to 1 year in practice, the red 0 to 5 years in practice, gray is 6+ years, and then yellow is all respondents. And so it makes sense. Certainly those at the 25th percentile are fairly close, and certainly see, you know, physicians that are 10 or 15 years into practice that can be on the lower end of the spectrum, depending on their position. But as you get out to the 75th percentile, certainly those that have been in practice for longer have had an opportunity to increase their total annual compensation to a more significant place than those that are younger in their career. When you look at the distribution, so this is 0 to 1 year in practice, and you can see there's a bit of a bell curve to this. Certainly the sweet spot seems to be between 200 and 250,000. I'll tell you that this has increased even over the last 3 to 4 years, where the starting salaries seem to be starting at a higher place, which is fantastic. But gives you an idea of kind of where people start, and there's some bell curve to this. When you look at 0 to 5 years, it's similar in that, again, you're seeing the majority between 200 to 250,000, but a little wider peak to the curve. And then when you look at those that are 6+ years in practice, you'll see that on the right side of the slide, you're seeing more and more individuals that are up above 300,000. So you see a little bit of a bimodal distribution, where you get the peak similarly around the 200 to 250, and then another peak as people get closer to 300 to about 340, 360,000. This is just putting these together and just trying to highlight the bimodal distribution of those that are 6+ years in the blue compared to 0 to 5, which is more shifted towards the left. And of note, these slides will be posted on the AMSSM website here in the next couple of days as well. There is a slide set that's up there that's a smaller slide deck compared to these, and so we'll update it with these more advanced slides. One thing that has been interesting that I've looked at over the last couple of years has been when you break down annual compensation by gender. And so certainly wanted to present that information just because I think it's very interesting, and I think it's something that should be out there as much as possible so that people have an understanding of any disparity that's out there, and be proactive with changing that if possible. So this is the 0 to 1 year group. More represented in the males with 41 compared to 24 females. You can see that the average salary in the 50th percentile are relatively close, certainly about a $5,000 difference in the salary, and just a $2,500 difference in the 50th percentile. And so some mild difference there, although when you compare it to these other groups, it actually looks like potentially that gap is closing, which is certainly just a 1 year sample here, but encouraging to see. When you look at the 0 to 5 years, you see a much more significant gap in the average as well as the 50th percentile. And so you see about $16,000 difference in the average salary between females to males, and a little over $11,000 in the 50th percentile between the two. And then when you look 6+ years, you see the gap is even larger. So nearly $40,000 difference in average salary between males and females, and about a $22,500 difference in the 50th percentile. So one thing that's going to be interesting over the coming years is those individuals in that first year group, whether they continue to have a closer gap, or as people get further into their career, if there's a bias towards increased salary for males. And so that's something that I think is important to highlight and make known, because this is something that I think employers and hospitals should be aware of, and do what they can to make sure that this gap is continue to be decreased. So how about if we look by primary specialty, 0 to 1 year into practice. And so you can see the key at the bottom there, but I'll go through it with you. So the light blue is family medicine, the red is PM&R, the gray is pediatrics, yellow is internal medicine, and the darker blue is med peds, which is just a smaller group. So what you can see here is over, across the board, not that dissimilar. The PM&R group is slightly higher than the family medicine, but the family medicine and the internal medicine are pretty similar, and then pediatrics is just a touch below that, but overall fairly similar. When you look at 0 to 5 years, that trend stays pretty similar as far as the differences, and so you'll see PM&R is slightly higher than family medicine and internal medicine, and then pediatrics just below that. In this group, there were 5 emergency medicine docs, so small sample size, but certainly we're on the higher end from a compensation standpoint compared to the rest of those in this 0 to 5 year group. When you look at compensation by primary specialty for those 6+ years in practice, then again, it's somewhat similar, where the PM&R has a slightly higher average compensation compared to and 50th percentile compared to family medicine and internal medicine, which are nearly the same. Pediatrics just a little bit behind, and emergency medicine just slightly above. One thought, what is behind this difference? That's not something I've dug into from a survey standpoint. Certainly was having this conversation with someone, and some of it may depend on procedures and different training for different individuals, and so that's something that I think is really interesting, and would be something that we're going to be digging into more in the coming years. A common question I get is, does it matter what area of the country that I practice in as far as my salary? And so we've looked at this for several years, and there are some hints towards trends, although it's not always reproducible year to year for those that are just coming out of training. When you look at the 0 to 1 year group, the Midwest initially, along with the West, tend to have a slightly higher average and 50th percentile. It's lower in the South and the East. As you get into the 0 to 5 years, the Midwest is a little higher than all three regions. And you can see that as we go into the 6+ year group, the East actually jumps up a little bit higher. And this is something that seems to be a trend that we've seen over the last several years, where the Midwest may have some of the higher starting salaries, but over time, the East tends to be a little bit on the higher side. The South may be related to cost of living, tends to be more in the middle or on the lower side. The West can have some variation. A common question that we get is, what is your dollars per compensation or dollars per RVU compensation? This is something that I think I'm hearing more and more graduates that are coming out that this is part of their contract. And so this is something that we're trying to look at more with the survey. This is something that I think there's a pretty wide variation on as well. When you look at the range, which I don't have on the slide, but the range is pretty wide for this. But when we try to get some averages in the 50th percentile, you can see that the 50th percentile, both for those 0 to 5 years as well as 6+ years, is around $50 per work RVU. The average is slightly higher for those 6+ years into practice, and certainly some of those individuals that reported a much higher dollar per RVU were in that more experienced group. So this is something that we're continuing to track, and something that can be really helpful for people. And so if this is something that you are working into your contract, I'm happy to dig into this data a little bit more for you. And my email will be up on the end here, and I'm happy to give you some feedback if you have specific questions about this from the standpoint of some of the data that's available from the survey. So clinical practice setting is also explored in the survey. And so I wanted to present some data with regard to the clinical practice setting. So this question is, what is your clinical practice specialty? And really is getting at, are people doing sports medicine only? What maybe in orthopedic practice? Are people doing their primary specialty and potentially seeing some sports medicine as part of that? Or is it truly a mixed, where people have some time dedicated towards their primary specialty and then potentially some time dedicated to sports medicine? And so you can see it's fairly evenly split as you get 0 to 5 years, although the 0 to 1 year group has a larger group that's doing their primary specialty. As I'm looking at this, I interpret that as there are a handful of individuals that, as they leave their training, may start a practice where they're really doing essentially their primary specialty. As they get a few more years into their practice, they may do less of their primary specialty and either flip into a mixed group or a sports only practice. And so this, I think, is interesting. It's pretty common when we have applicants to our fellowship, we'll talk about what you want to do. And it's pretty common that people either fall into the, sports only or the mixed group. And that's mostly what we're seeing, although certainly for those fellows currently out there is a group that certainly do their primary specialty initially in their first job and may or may not switch into something else as they get farther into practice. When we compare the 0 to 5 year group compared to the 6+ year, you can see that there's really not much of a difference. And so for the survey, there's still a large contingent of people that do a mixed group as they get farther into their practice, not necessarily always flipping into a sports only type practice. And this question in particular looks at specifically for each individual's practice, what percentage of the practice is sports medicine related. And so in the blue, we have those that are 0 to 1 year in practice. Red is 0 to 5 years, and gray is 6+ years. And you can see the numbers of individuals answering this question on the bottom. And then the percentages on the left are percentage of physicians reporting in this group. And so if we look at, it maybe is easiest to start all the way on the right. So those that say, hey, 100% of my practice is sports medicine related. Interestingly, a larger percentage of those in the 0 to 1 year group reported that that was the case for them compared to either of the other groups, the 0 to 5 years or the 6+ years. And so this may indicate, this is just 1 year, but it may indicate a trend towards individuals joining either more of an orthopedic practice or a sports medicine dedicated practice. And that's certainly a trend that we're going to look at. As you look at the other percentages, so the 40 to 99%, certainly you can see a trend where the higher percentages, with the exception of the 100%, but the higher percentages tend to be in those in the 6+ year group. It may be an element of over time, individuals' practices become more sports heavy compared to when individuals start their first few years. So just some interesting data, especially as you're looking at what type of practice you're going to have. You get a sense of what other individuals are doing, right? How much percentage of their practice is sports medicine related, and you can get a sense of what that looks like for individuals. So team coverage is something that I think a lot of individuals, when they are looking at job opportunities, are also interested in what's my potential for team coverage. I think that's an essential part of what we do as sports medicine physicians. And certainly a lot of people enjoy that. There are others that don't. And so we like to look at this data and give you a sense of what individuals are doing in their practices. And so this is those individuals that are just out of their fellowship. So 69 responses. And on the left there, you see that of those that said that, yes, I'm a team physician at some level, 60% of those individuals are doing some team coverage. And when you look on the right, out of those 42 individuals that are doing some team coverage, you get a sense of where they are doing their team coverage. So professional is about 16%. Olympic is only about 7% of these individuals are doing some work with the US OPC. The Division I is about 40%, which is actually a pretty good percentage compared to past years. And then almost 80% of these individuals are doing some high school coverage. So very common for those that are functioning as a team physician, newly out of fellowship. High schools is a really common thing that they're covering. When you compare that to those 0 to 5 years in practice, you can see that the professional group increases to 23.5%. The Olympic group is still fairly small. The Division I group is similar to the 0 to 1 year at close to 40%. And still in this group, 38% of the 200 individuals that are doing some team coverage are covering high school. You'll also see that compared to the 0 to 1 year group, a larger percentage. So 60% of the 0 to 1 year group compared to 78% of the 0 to 5 year group are actually doing some team coverage. And so it seems to be some individuals, as they get established in their practice, may pick up some team coverage, which makes sense. And then when you compare to the 6+ year group, you can see that compared to the 0 to 5 year group, again, the professional percentage increases up to 36%. And this is where you also see an increase in the Olympic coverage group, which again makes sense, I think, as individuals get more experience and get some opportunity to work with our Olympians and international teams. I think it makes sense that we're starting to see more and more individuals in the 6+ year group working with those groups. The Division I is fairly consistent still, around 40%, and still a lot of individuals 6+ years that are doing high school coverage. So slightly less percentage, but still close to that 3/4 of the group doing some team high school coverage in the 6+ years in practice. And again, this group, 78% of individuals are doing some sort of team coverage. So, a common question that I think is coming up more and more is, are individuals compensated for team coverage? And this, I think, has a lot of layers to it. Certainly Einstein, as you can see here, discovered that time is money. And so certainly team coverage takes our time. And so the question is, should we be compensated for that, or how should we be compensated for that? And I think that's a topic that probably deserves its own webinar, but I can look a little bit at what some of the data shows. So for those 0 to 1 year in practice, the question is, are you paid a stipend for covering any of the teams that you care for. And only about 7% of those 0 to 1 year in practice are paid some sort of stipend for covering for these teams. If you look 0 to 5 years on the left compared to 6+ years on the right, you can see that those numbers increase. And so 0 to 5 years, about 17.5% of those individuals are paid some sort of stipend for team coverage, and the number grows to about 30% in the 6+ years in practice. And so, as I mentioned, I think this is kind of a fascinating topic and something that I think you'll get responses all across the spectrum. But from a data standpoint, it certainly seems to be a trend that I think is becoming more common, that individuals are paid a stipend for team coverage, although certainly is not the norm yet either. And so at this point, certainly would love to open up for questions. Happy to take anything. Please don't hesitate to reach out to me. My email is probably the easiest, although my cell phone is on there as well. And if you have a contract that you're looking at and have some specifics you would like, you know, I'm looking at college, you know, medicine in Indiana, then I'm happy to give you some details about some of the information that's out there. So please don't hesitate to reach out. I'll go ahead and stop the share here. Great.
Well, I will go ahead and kick us off as we start to get some of those questions filtering in through the chat window. So currently you were showing that sports medicine physicians that practice 100% sports medicine are right around 30 to 40% at the 1 year out, 5 year out, and 6+ year out mark. Where, being in the realm of in the sports fellowship, where do you speculate that the future statistics are heading?
Yeah, it's a good question. So I think as we see the salary increases over the last few years, it's impressive. And a project that I'm working on is trying to look at this over the last decade or so on what's the trends, and my sense in just looking at this all the time is the numbers are certainly growing quickly. The reasoning behind that I think is harder to hash out. Some of it may be the increase in the PM&R physicians that are going into sports medicine. As you can see that their average salary was a little bit higher. Some of it may be driven by the orthopedic surge, more individuals that seem to be doing 100% sports medicine. I think some of it may be related to procedures, and certainly from an RVU standpoint, as my sense is as RVUs are becoming more common, that may allow for more incentive-based contracts, which I think is going to lead to higher salaries as a whole, both starting off and as the individuals get into their career a little bit farther. So.
Awesome. And then what about, so there was a really huge proportion, which considering I remember having taken this survey, it's pretty extensive, takes a bit of time. There was a lot of respondents who were at that 10 or more years out of fellowship, and a really good amount. It was, you were saying it was right around 60% total of the respondents were 6 or more years out. Is there any major differences when you're kind of crunching those numbers? Is there any major differences from that 6 to 10 year mark versus the 10 or more year mark?
Yeah, so when I looked at that, as you can imagine, right, those 6 to 10 years versus 11+ years, we do see some differences in the average and the 50th percentile. It's about a $10,000 difference on average for both the average salary as well as the 50th percentile. So as individuals get further into their career, it's not a huge difference, but there's about a $10,000 difference when you look at those two metrics. When you look at the specialty, for those that are 6 to 10 years compared to the 11+ years, we started to see an increase in both pediatrics and PM&R, and kind of a relative decrease in family practice for those completing the survey. So I think as if you look at the 11+ year group compared to the 6 to 10, you're starting to see that trend. And then if you look at the 0 to 5 years, it's more clear cut that we're seeing more PM&R based specialists, and you also see a trend in the 6 to 10 year group of more individuals doing 100% sports medicine versus those in the 11+ year group. I think that was close to 35% compared to 25%. So 35% of those in the 6 to 10 year group are doing 100% sports medicine compared to 25%. So it seems to be a trend within our specialty that more and more individuals are doing 100% sports medicine. The other area that stood out to me is which probably makes sense. A higher percentage of those in the 6 to 10 year group are incorporating ultrasound into their practice compared to the 11+ year group. So that was something that I think makes sense, but certainly was seen in the data as well.
Now, how about there's a question here that's asking about if there has been any delineation done between academic versus private practice versus multi-specialty practices in terms of, and I'll kind of maybe expound on that, maybe in terms of the demographics, just of the, what positions are they taking, but also income?
Yeah, it's a great question. The survey has changed in the exact questions they ask a few times over the last several years. As I mentioned earlier, the range of different types of jobs is incredible among sports medicine physicians, and it makes it very difficult to break it down into academic versus private versus multi-specialty, because there are a lot of individuals that don't fit nicely into one nice box, and so we used to be able to look at this more easily than we do currently with the survey, and I'll tell you, in general, there wasn't a huge difference when we looked at, the question was always, well, are academic folks making less? And there was a trend that direction, but it really was not a huge difference between academic versus private practice. And so that's not something I've been able to easily look at over the last couple of years, unfortunately, and it's just because the jobs are so heterogeneous.
All right, okay, the next question is, how does the AMSSM survey data generally compare to other compensation data resources like MGMA that you've alluded to a couple of times?
Sure. So there's some similarities there in general, and this is in general, the MGMA tends to run a little bit higher than the AMSSM. In part because I think of some bias amongst who fills out the survey. There tends to be a slightly higher, younger group that completes the AMSSM survey. There's also, as I understand it, some probable bias in the MGMA survey, in that individuals that are reporting their data are more likely to be able to afford being part of that group. And so they may be a more organized clinic or have an office manager that sees value in being part of that, of the MGMA. And so certainly there's some question of whether those salaries are larger than what the actual number should be.
All right, so the next question is about, is kind of pigtailing in a different direction in regards to building a contract. This is someone who is going to be doing a mixed position based on our survey, a mixed position between sports medicine and internal medicine. They would like to do coverage, but they are not being provided malpractice coverage at the games. And so they're looking at building a contract at the high school and junior college level to protect themselves.
Yeah, that's a good question. And I think there are probably individuals that are better qualified to answer this. I do think you're looking at it the right way, and I think that's an important component of it. I will tell you there are a lot of programs that would provide that malpractice coverage, and so it may be something that you can bargain for in some way, that you're covered as part of that role. Certainly if they're supportive of you doing the coverage, then that probably is not a huge additional cost to the malpractice. But having not gone through that, I don't know that I have great specific advice on that. I don't know if Michelle, if you have other thoughts on that.
You could get a separate rider. You could, if you're getting your own malpractice insurance, you could get some quotes from some other folks, especially if this is your first position. You could kind of negotiate with your employer, just like you were saying about, the value add to the organization by you doing this. They can, post about you on social media. They can, get more patients coming from your doing that coverage. So it would certainly offset any additional costs, like you were talking about, being pretty nominal, especially if you're doing internal medicine. It might be a hospital employer, so it would be pretty nominal. They're typically self-insured, so it's not necessarily an out-of-pocket cost for them to add that coverage. And then if not, then it lends to you, and I'll kind of piggyback there to the you had presented about the payments and getting paid for, and it's not necessarily a direct payment, but it's an indirect payment. If a junior college really wants you to do it and there's literally no one else that would be interested in it, potentially talking with them about covering your malpractice and then maybe doing it as a volunteer. But I would question and put this one out to Matt is, how what do you foresee as the future of team coverage as we start communicating with more and more people about there are ways to get paid, and as time goes on, people figure out those ways to get paid? Is that going to change the future of team coverage?
Yeah, it's a great question. I think before I jump to that, Elliot, who in the chat mentioned to this last question, recommending watching the second webinar of the sports economics series, and then Andy Meyer linked it there. So that may be some even better information there for you, Edward. As far as the future, it's interesting. As I mentioned, I think there's a lot of layers to this, and so certainly you have the element of a lot of hospital organizations actually paying teams, right? When you look at the professional and college level for the opportunity to provide coverage. And so it's interesting. It's a very interesting dynamic. My sense is that over time at the professional and college level, you're going to see more of that, where hospital systems are paying to provide coverage to a professional team or an organization. And more at the high school level, I think you're going to start to see more high schools or smaller colleges that are actually paying for coverage. I think that's the trend we're going to see. It's going to be an interesting dynamic, because I think there's going to be differences between those two levels of coverage.
And Elliot did put a response back, and I can read that briefly. Thanks for watching that lecture. With large organizations, it's difficult to negotiate since they can bully you around. I had some issues with this when I did private practice and also when I worked for Kaiser. Short answer is that I contacted the malpractice provider myself and explained my role. Not doing anything outside the standard of care, still in a clinic setting, covered by Good Samaritan for emergencies, and they just added a rider. And then with Kaiser, they didn't want to provide the malpractice, but the college that I covered purchased a separate malpractice policy to cover the trainers, the students, the physicians, the fellows, etc. So if the organization doesn't budge, you can negotiate with the school, especially if you're doing things for free. Okay, so our next question is, was there a noticeable increase between, not necessarily from a timeline, and that's not necessarily from a timeline perspective, but rather from a first contract and a second contract? If there's ever been at some point anything that looks at it in that particular perspective.
Yeah, it's a great question. It has not been looked at in that way as far as a contract, first for second contract. I'll tell you, certainly I think a lot of individuals, their first job, is certainly not their last job. And so it's very frequent, 3 to 5 years in to be, rolling into a potentially second position. It's just a common phenomenon. And so I do think there's some element of kind of the 0 to 1 year versus, the 5 year numbers. And so I think you're right in that that's the thought process behind that, but it has not looked specifically at, first, second contract.
Well, and then what about, rather than maybe looking at first contract, second contract, have, from a contract perspective, sometimes in private practice, you may not have all the bells and whistles that you have in a large employer practice. Have they ever looked at compensation from the perspective of, is the question to salary alone, or is the question to malpractice coverage, and that cost is approximately this, health insurance is approximately that, the 401k matching, kind of adding those things in, or is this kind of that straight salary amount?
So I think the compensation question is primarily that straight salary amount from the standpoint of what am I actually making from a salary incentives. There are some questions that look at overhead, and I think a lot of people would tie that into their private practice. And so I have in the past looked at specifically for individuals that are interested in, hey, I'm going into practice on my own or joining a small group, and they're responsible for some of that overhead. There are some numbers that I can break down and provide some feedback on that. So there is a way to look at it. It's not all that clean, but at least there's some examples out there for what individuals are doing. There is information on the survey for those that are in private practice and what services do they provide. So, hey, trying to remember the numbers, a certain percentage, provide x-ray as part of their, in their practice, a certain percentage provide PRP or ultrasound or durable medical equipment. And so there are some numbers out there. If someone's especially going into private practice and these are decisions you're having to make on, should I provide that, then there are numbers out there as far as, well, what percentage of people that are in the type of practice that I'm starting, what percentage of people offer those things. The cost, I think, between those things is a little bit harder to really break down, but maybe tied into that overhead piece.
And then there was one of the people who had answered the survey kind of stuck out, and we always like to talk about the positive ones, certainly. And that person, it looked like they made around $750,000 a year. So wow. Can you speculate on maybe what might that person be doing? You think is that person doing team coverage, sports? Are they doing 100% sports, cash pay?
Yeah, that's a good question. I can tell you it's not me. That individual, and certainly not giving away any personal detail, is 100% sports medicine in private practice. They reported being straight volume reimbursement, meaning all incentive based practice, not salary. We don't really ask whether it's cash based. I think it's a great additional question that that should be added into the survey, because I think that's something that you're seeing a little bit more of. And they do some professional team coverage as well. They did not answer the question on whether they are compensated for their professional team coverage, so that potentially that may be part of it as well. So it was the type of job description that was not unlike a lot of others. To be honest, there were a lot of people that had very similar answers, but this person's, the compensation was a little bit higher. So, I don't have a specific answer on why theirs was higher than others, but that's kind of what they were looking at, was private practice and incentive based.
And there was a little bit more conversation going on back and forth around the challenges of working with a large organization. Okay, here's the next question. Any idea what kind of RVU higher earners are working?
Do you think that's asking what dollars per RVU?
That's how I would take that. Yeah, what would be on the higher side of dollars per RVU? So kind of.
So yeah, it's a good question, and there's a huge range. To be honest, it's there are individuals that report over $100 per RVU, some that are into the 120s. The survey doesn't clarify, are they just calculating that based on, hey, I know what my RVUs are and I know what my salary is, and so I'm dividing those numbers, or are they actually, hey, this is in their contract of you earn $120 per RVU. But that certainly was on the higher end of dollars per RVU. If you look at just RVUs, it's a huge range again, and so the averages are kind of, I think someone mentioned in the chat, somewhere around that 5,500 range is pretty common, and probably between 5,000 to 6,000 is the most common answer that I see. I'd have to run the numbers. I don't have from this last survey what the actual average RVU, although I might be able to find it pretty quick here. Looks like some individuals maybe have looked at this recently. In ortho sports practice, the minimum was 5,500 and the average was closer to 6,300 to 6,500. Edward had shared was numbers that he had seen. And I think that's similar to what is in this survey.
And what would you say? I don't live through RVUs, but just being in private practice, what would that kind of translate to in patient volume? Would you say and not necessarily a per year, but per day or per half day to hit those?
Yeah, that's a great question. I don't work on RVUs either. And so there may be a way to look at that with the data, because we do ask how many patients per half day you see. A lot of that may be more based on, are they procedural, where you're doing more RVU per patient compared to just clinical visits. So maybe a little bit of apples to oranges as we're looking at that. So good question.
Okay, she's clarifying. So if we know for those top earners for it will, and granted this guy is in, if you were talking about whoever the person is who is in private practice, they're not going to be collecting RVU data, but for these top earners in sports medicine, about how many RVUs are they generating annually? And then you're suggesting kind of they'd be then on the upper limit of, if the average is 63 to 6,500, you're saying it would be above that.
Yeah, I'll tell you there are people that report over 10,000 RVUs per year. I haven't done the analysis to see does that correlate to the highest earners, although in some ways certainly makes sense if they are on an RVU based compensation plan. So there are numbers. The numbers are just more or less frequently above kind of 7,000, but just looking at the overall data, there's probably 25 people out of this page of 700 and some respondents that are above 7,000. So it's not a high percentage that are above 7,000, but there certainly are individuals that are in that range.
And then we have a couple more minutes left, so if there are any last minute questions.
My email I'm gonna add to the chat here.
Perfect.
Like I said, I think I probably get 20 to 30 emails a year asking for kind of specific data, and so I think that's something that I'm happy to look at, and often it's helpful for people to look at specifically, here's my situation, what kind of numbers are out there. I think it just allows you to feel more confident, I think, going into your negotiations, that you're either, crazy or not crazy for what you're asking for, or and have something to really back up, what you think you're worth from a contract standpoint. So please don't hesitate to reach out if you have that question.
How long have you been reviewing the data?
So I think I got tricked into doing it maybe in 2013 or so. So 8 or 9 years, and so I've seen a lot of questions, and certainly I think it's something that's hopefully has been helpful for people. It's kind of fascinating to see that the numbers increasing over time, and that's why I'm really excited for this project that hopefully will be done by the annual meeting, where we're actually kind of able to look at it on more of a longitudinal basis on what some of the averages and 50th percentiles have what they've done over time, because I think it's really interesting to look at.
Absolutely. Wow. I had no idea that. And it's, it's the one guy who got tricked in.
Yeah, right.
Okay, there's another question here, and that's, did the data touch on how ultrasound is used, procedures performed, joint injections versus more advanced diagnostic procedures? Was any data that broke it down in that detail collected?
They really don't. On this, it's more of a, do you use ultrasound or not in your practice? Unfortunately, I'm trying to think if that data would be out there somewhere. Not that I'm aware of, but it may exist.
Great. Well, that certainly got us through the time period really nicely. So if there's any last minute burning questions, I can certainly throw those out there, but I think we've hit on most of them at this point. So I would then thank everyone for attending, and thank you, Dr. Leisler, for fantastic information. There are a wealth of information certainly that you've gathered, not only this past year, but over the last 9 years, 8 or 9 years there. Wow. And definitely looking forward to your presentation at AMSSM, giving us that longitudinal information, showing how we're continuing to grow, and all the good things that you find as you aggregate the data in that way.
Great. Thanks so much for having me tonight, and thanks for everyone for joining and viewing this at some point. And keep an eye out for this data. Will be uploaded to the AMSSM website very soon, so you can see some of the specifics if you missed it on the slides as we were going. So thanks so much.